Good morning, everybody. This is Dr. Nemechek of the Nemechek Protocol here in Buckeye, Arizona. We're in our new little digs. As you can see, I don't have that big mess behind me anymore. We've got nice steer hide rugs, and we're all Arizona here all the time now. So it's kind of the way we were living at home, and we finally got the office up to match our lifestyle. So it's very nice. People really like it. But what I want to talk about is trying to make things better. Now, there's this old adage in medicine and in lots of things that better is the enemy of good enough. And this is a very, very well-deserving phrase and has a lot of application in medicine, whether you're dealing with somebody with heart failure or stroke or autism. And the point here is that we only need good enough. This sounds like you're accepting something that's imperfect. That's not the case. The point here is we have children who have a great deal of difficulty attaining developmental recovery improvements with standard therapies. And when you use the Nemechek protocol, you get a fairly dramatic improvement in recovery. The same thing with adults, dramatic improvement in recovery. Now, one of the things that you can't appreciate, and quite frankly, it's hard to measure, is that the brain, the nervous system, can only recover so fast. It's slow. That's why I use the phrase, you recover about as fast as your hair grows, because just the neurons in your brain don't recover quickly, okay? You cannot speed it up. So, and I understand parents have seen their children with lots of problems. They haven't spoken in years and struggles and the pain that you can see on your child's face. I understand the desire to want to kind of speed this thing up. But the problem is the things we often add to the regimen, or that people add to the regimen, get in the way. So that's where good enough is the protocol and you're seeing this improvement. Better is adding some supplement or vitamin or digestive aid or something like that, and your progression stops. Not only stops, it's still, after all this time I've been talking about this, every week or two I get reports from people, I should have listened to you, I put them on XYZ, boom, 6 months of speech gains that we had were lost in 2 days. Okay, and then the parents will stop the therapy and they'll pick things back up in another 2 to 3 weeks often. So once your child has made this shift and you're seeing recoveries and your therapists are seeing recoveries that are far beyond what they had before, just sit tight. Don't try to make it better. It's good enough. Time is going to fly by. The next thing you know, you're 6 months from now and wow, you got a different kid, okay? And if you didn't cut your hair for 6 months, you'd have a ponytail too, right? You just got to wait and let things happen that way. Now, the one exception I would say here, because I can just imagine people say, well, what about the OT or their PT or the therapist and things like that? If a child's having difficulty with some basic functional needs, yeah, continue those things. Those things are help to prune, all right? I mainly, when I'm talking about better is the enemy of good enough, is starting to ingest other things for the kids. All right? So, good enough. All right? Enemy is the better. Or better is the enemy of good enough. Just remember that, and that the brain can only recover as fast as your hair grows. So this is Dr. Nemechek of the Nemechek Protocol in Buckeye, Arizona. Hope you all have a great day. Take care now.